Hi everyone, welcome back to my YouTube channel, and today we are going to talk about sarcoma. So let's start our topic with introduction. Sarcoma is a rare type of cancer that arises from connective tissue of the body, such as bone, cartilage, fat, muscle, blood vessels, or fibrous tissue. Unlike carcinoma, which develop from epithelial cells, sarcoma originate in mesenchymal tissues. They account for less than 1% of all adult cancer but are relatively more common in children and young adults. Definition of sarcoma. Sarcoma is defined as malignant tumor of mesenchymal origin that is capable of invading surrounding tissue and spreading to other parts of body. That is called metastasizing, and it is most commonly metastasized to the lungs. Types of sarcoma. First is soft tissue sarcoma. These types of sarcoma arise in muscle, fat, nerves, tendons, and blood vessels. Examples include liposarcoma that occur in fat tissue, leiomyosarcoma that occur in smooth muscle tissue, angiosarcoma that occur in blood vessels, and synovial sarcoma that occur near the joints. Then other type of sarcomas are bone sarcomas. They originate in the bones, and the common example of bone sarcomas include osteosarcoma, chondrosarcoma, and ewing sarcoma. Causes and risk factors of sarcoma. The exact cause of sarcoma is often unknown, but certain risk factors increase susceptibility. They include genetic mutation and inherited syndromes, radiation exposure, especially for the previous cancer treatments, chemical exposures such as herbicides or vinyl chloride, chronic lymphedema, which increase the risk of angiosarcoma, and age and gender, as some sarcomas are more common in children, like ewing sarcoma, or young children adults, that is osteosarcoma. Symptoms of sarcoma. Symptoms depend on the location and size of tumor. Common signs include painless lump or swelling. Often it is the first symptom. There is pain or tenderness if the tumor presses on nerve or muscles. There is restricted movement or stiffness if it is present near a joint. There is bone fracture in case of bone sarcoma. And there is general symptoms that include fatigue, weight loss, or other systemic symptoms in advanced stages. Diagnosis of sarcoma. Diagnosis involves a combination of clinical examination, imaging, and laboratory tests. They include physical examination to detect lumps or swelling, imaging techniques like X-rays, CT scans, MRIs, and PET scan to determine the size and spread of the tumor, biopsy, that may be core needle or biopsy or surgical biopsy, to confirm the malignancy. Blood test can be done to assess general health and organ function. Treatment of sarcoma. Treatment of sarcoma depends on type, stage, and location of the sarcoma. The main approaches include surgery, that is the primary treatment. It involves complete removal of tumor with surrounding healthy tissue to prevent recurrence. Second treatment option is radiation therapy, that often used before or after surgery to shrink tumors or to kill remaining cancer cells. Third treatment approach is chemotherapy, that is particularly useful in certain types like ewing sarcoma and osteosarcoma. Fourth is targeted therapy, that includes drugs that are designed to block specific cancer pathway. Fifth approach is immunotherapy, that helps the body immune system recognize and attack cancer cells. Prognosis of sarcoma. Prognosis of sarcoma depends on factors such as type and grade of sarcoma, size and location of tumor, extent of spread, response to treatment, and generally early detection and treatment improves survival rates. However, high-grade sarcomas have a higher chance of recurrence and metastasis. Preventions of sarcoma. Since the exact cause of sarcoma is often unknown, complete prevention is difficult. However, some preventive measures include avoiding unnecessary radiation exposure, to reduce exposure to harmful chemicals. It can be prevented by regular checkups for individuals with genetic predisposition and by early medical attention for persistent lumps or unusual symptoms. Conclusion of this lecture video. Sarcomas are rare but aggressive cancer that originate from connective tissue. They pose unique challenges due to their diversity and tendency to spread silently. Advances in medical research, including targeted and immune based therapies, are improving survival outcomes. Awareness, early diagnosis, and appropriate treatment are vital for better management of sarcomas. And this was all about sarcomas. Hopefully, you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.